Health insurance is a kind of medical insurance that covers expenses in the case of medical illness of a patient. What if I tell you that there exists a health insurance which deals actually not just with the medical expenses related to the illness, but also with the disease prevention, that you won't need to go to a doctor and, to go for invasive surgeries that are unneeded. My guests today are from the startup named Ana Health. Let's discover more about them and their journey. Welcome to Innovation from the Global South on Future Frame TV, the collective podcast of Traces&Dreams. Hello everyone, this is your host Dr. Almas Taj Awan on Innovation from the Global South on Future Frame TV, the collective podcast of Traces&Dreams. Today with me, there is a team of Ana Health, telemedicine startup based in Brazil. Is it something like, traditional telemedicine, or it's something different? We're going to discover this today. The team that I have here is Olívio, Vinicius, and Víctor. Welcome to the show.
Thank you, Almas. It's a great pleasure to be here with you. We have done a very nice and great work for innovation.
That's great. Quickly, if you three can introduce yourself.
I'm a doctor with 20 years of experience in cardiology, specifically performing minimal invasive cardiac surgery using robotic and video-assisted surgeries. With 2 years of international experience working in national health service at Hereford Brompton Hospital in London, in Leipzig, Germany, in Heart Central. I have 5 years as an executive in the health industry, and I always have noticed that people only consume healthcare when they have problems. Think about that. I start to think about how to solve this kind of problems.
That's great. Victor?
I'm an industrial engineer, and I have a master in design process. In the end of my master, I started a company that worked with design consultancy and prototyping, and then I get into the academic side of my career. So I started a PhD and had contact with some international networks like Sugar, that is related with Stanford University, and also with PDP, that is related with Aalto University. And I could learn a lot about how was teaching how to develop products and services in the school. And then I started working as a professor in a business school here in Brazil that calls INSPIR. And there I met Olívio with this big dream to solve health issues. And I started get involved in the sector and learning a lot with him. So now I'm here putting in practice all things that I study and developing these products and services in Ana Health.
That's great. We are going to come back to you to know more about your journey. Before that, Vinicius is waiting for us. Vinicius, please shortly introduce yourself.
I'm Vinicius. I'm a computer engineer focused on data science. I started to deep into the technology aspect applied in health after passed through a lot of health problems, health issues. And I decided that my purpose in life is to build technologies to help save others people's life. I was invited by a hospital and health operator to start the technology sector in the company. And I was able to witness the birth of the health operator and understand a little bit of the backstage of the health operation itself. But my job was to optimize the process of the company, having little impact on the tip, improving the lives of the beneficiaries. I left the company and started artificial intelligence company for diagnostics, focused on democratizing access to COVID tests. We used CBC, complete blood counts, where the results were processed by machine learning algorithms, and we were able to diagnose the person with more than 85% accuracy. But I was the only partner and I didn't have much experience in the health sector and neither in launching this kind of product in the market. So when I met Victor and Olívio, two like-minded, crazy people who were putting energy into turning this disease system into a true health system, I couldn't stay out of it. So I joined the company to lead the technology area with one foot in product.
That's great. So you just mentioned that, you just met a group of crazy people. So is it important to meet crazy people for making something different?
I think to understand that it's possible to break the system and to change the system, you, of course, have to think out of the box.
Exactly. So, Olívio, quickly, I would like to ask you this very basic question. What is Ana Health for you?
Ana has a new approach to the health system, focusing in first mile. What is it? We spend most of our time at our homes, neighborhoods, at workplaces, building families and communities. Yet we still think of health as something that happens at doctors' offices or hospitals. If we think of health as something that happens in those places, we miss the opportunity to strengthen health wherever you are, which means the place which you call first mile. Ana is a technology tools made by human to stay with people at the first mile.
So how is it different from the traditional telemedicine technologies and application? I mean, the apps that we have, and we have seen in the recent, last 2 years during COVID-19 that there were many apps that came in the market throughout the world. When you see Ana Health, how it stands out from the rest of the market?
First of all, Ana Health is not a telemedicine. Telemedicine is just a tool for us. Ana Health is a framework, is a technical way to understand how we deal with 5 situations. Time, we always writing to reach people worthy, help people thrive. Place, we always trying to get closer, knowing what local community truly need. When I told about local community, it means neighborhood, it means workplaces, things like that. Context, understanding people's unique circumstances. It means dynamic needs and individual relationship to health. Mindset, giving people the knowledge, tools, and incentives to support our own well-being and health to all the community. Memory. We work with memory. What means? Recognize the legacy of history's events that shape people's attitudes about health. And, of course, planting seed for good health today to become to positive legacy to the tomorrow or the future.
Right. And how these services are being provided by Ana Health? Like if a user downloads the app, what the user can get?
So we understand that like the easiest way to be like at the time and moment that the users want the health service is not through an app. So people are used to get in touch with their friends, their families, their colleagues using 2 main channels that are phone calls and also WhatsApp. Here in Brazil, we are a huge market for WhatsApp. So we are in this places like a kind of friend, right? So Ana is as a health professional friend that you can count every time that you need. So we build this trust relationship through some techniques that we incentivize the bond between the health team and our users, our members. So they get in touch with us for these channels without need to download an app that we think that is a kind of barrier for people to have access to health services.
Right. Do you see any competitor of Ana Health right now in the market, or this is a unique idea that you guys have?
I think we have two great benchmarks that we follow. We follow Ping Yang Good Doctor from China and Babylon. Babylon is doing a great job around the world. And of course, they are not competition, but the benchmarks that we are trying to understand how they are working, because they are really doing a great job.
What is the strategy for entering the market, customers, and also the investors?
The first step, you understand what's the needs that the population have. When you talk about health system, you have two bottles and you have two problems: affordability and accessibility. Our strategy in focusing these two problems, make the system more affordable and make the system more accessible.
I can see there are many services that are not provided currently in Brazil through conventional health insurances. And I can see on the website of Ana Health, Ana Health is, putting their efforts forward to bring all those services. One interesting thing that I saw, and you just mentioned as well, that Ana Health is also working on the patient's health memory, so that all the health history can be on one place and it can be easily accessible in the future. I was just wondering, what was that one thing or that one problem that made you guys think about Ana Health? Where was the start? I just want to know, the history behind.
As I told you, I'm 20 years and a little bit more in the industry. And I have the opportunity to work in both systems in Brazil, private and public. And I think that I have an uncomfortable feel about the system.
I think this is a question that I would like to hear the answer from Vinicius as well and from Victor as well.
The start of my studies, for example, was I went to São Carlos, a city in the interior of São Paulo state, to study aeronautical engineering. So it had nothing to do with what I do today at the University of São Paulo. Although I liked a lot of the physics and mathematics, I didn't see much purpose on building airplanes for the rest of my life. So at the first year at the computational engineering, I discovered nodules in my lung that could be occurrence of a cancer that I had when I was a teenager. The doctors suggested very invasive surgery called thoracotomy that removes a part of the lung. As it turned out that this nodulus was a fungus and the surgery unnecessary. And I know that the doctors made the best decision at the time with the information they had at hand, and if they had other information. So at this point, I dived into the artificial intelligence and machine learning and wondering how these technologies could help the health professionals to make better decisions. And exploring this, I see that, for example, of all the costs in health today, 1/3 is to pay the health professional salaries. And 70% of the other 2/3 is spent with things that could be prevented by technology, with prediction and things like that. And universities around the world cannot train a lot of health professionals to attend all the demand. So technology can help to decrease this gap. And when I observe what other health players make with technology, I see that they focus on technologies that digitalize the traditional model. The technologies is still focused on the disease. And nowadays we have quantum computing, we have the metaverse, we have 5G, we have a lot of interesting technologies that are being launched that can not just digitalize the traditional system, but rethink the way we deliver health. So here at Anna, all our technology is person-centered designed. So I think that all this stuff, the personal problems I pass it through and meet two other person that are bold enough to challenge the system, to really think or rethink the whole system is the reasons that I joined the Anna's team.
That's quite interesting, the story behind, all the journey that you shared. And this is the next question that I'm going to ask. But let me go first to Victor, because I think he also has something to say here.
As an industrial engineering, I think that I was always looking for a kind of systemic approach and looking through processes. So one way like to be able to help people building kind of products and services that would like improve people's life was kind of studying the processes and trying to be close to people that would understand like the problems, the sectors, to be able to kind of guide them through this path to build things. My journey was being specialized in this way and very close to students in all different levels, like graduate students, undergrad students, executives, close to the board of the companies, and I was able to kind of training these skills. And when I met Olívio, like he had all the knowledge of the sector, of the industry. And I could learn from him all the inefficiencies that the health system had. And like the main one that kind of sparked like my will to join this and starting working with this was mainly because a lot of the incentives that people have in the health industry are not aligned with people's interests. So during the experience that people have through this health services, a lot of times they are confronted with incentives from the hospitals, the pharmaceutical industry, the professionals even, that are not like doing the right thing to improve people's health. And when I could understand that there were like financial incentives that were kind of changing the purpose of all the health, I realized that sometime we can change the system and build something better, like something that would be more accessible, more affordable, and improve people's health.
That's great to know. I can see very clearly that you guys are actually bridging the existing gap within the system, and the difference in expertise that you three have. And I had the opportunity to know your other team members as well. I could very clearly see that how you people were trying to understand each other's vision and trying to, sum that up into one startup. Olívio, I think you are the CEO of the company?
Yes, like that.
Or the founder of the company?
Yeah, the founder.
Okay. So how was your journey? You were already had this background of knowing that, yes, you need people from different expertise to join you in this initiative? or it was something that, you had the vision, but with the course of time, you started discovering and, picking the right people to be at the right place within your startup?
Yes, great question and great issues, because I think the biggest change in this building was find the right people. I spent at least 2 years understand the problem and find the people. It was amazing when I find Víctor, and was amazing when I find Vini, because we are three generation, different generation. Then it's really important, because, like Steve Jobs said, innovation comes by bringing new experience together, rather than just collecting the same experience. When all the team understand that everything we know in healthcare is melting into air, it means that a new reality are being shaped. When I feel that all the team understand that, then let's go, let's start on a health.
I asked a question about the initial vision that you all had. If I ask you the collective vision of you all within Ana Health, what is that, or what would that be?
I would say that our vision is to break the system. So it's to change the way that health is being delivered through the traditional system, and use technology to improve the health team work. Then the health team can be closer to people, providing all this care and helping people improve their health in a daily basis. So being there every time, every moment that someone needs, and helping people to have like kind of health journey that they can change their habits, like being well in a physical, in a mental, in all perspectives, to being able to change their own world. So we believe that people that are healthy, they are able to change the world where they are, like their family, their friends, their neighborhoods, their communities. So this is our vision, using the technology to improve the way that the humans can deliver this total care.
Great.
Another question about what you just mentioned, that Ana Health is also reducing the gap that exists between human to human interaction. Am I right?
Yeah.
So how you people are making that happen, or you people are still working on that?
Certainly, we are always learning and reading about business, and everybody talking about B2B, B2C, B2B2C, and then we realize that we can be anyway B2B, B2C, B2B2C, but the first step that we have to think about, we are H2H, human to human, and then is why we take this suddenly. It's that we are human to human.
Okay, so my next question to you all is that I just went on the website of Ana Health, and it's the address is anahealth.app. So I just got to know from you guys during the interview that there isn't any app. So what does that APP stands for?
So the APP acronym is from Attention, Prevention, and Promotion of Health. That is a term very used here in Brazil. So in the health context, that we use as a kind of joke in our website too. So we don't have a traditional app, but we work through micro apps, through the conversations in your WhatsApp. So if you want to hire Ana Health and be part of our community, you just have to fill a simple form in our website, and we will get in touch with you, sending you a message, a WhatsApp message, and start the conversation. During these conversations, we send to you very contextualized links that you can, without move through another platform in your daily basis, in the middle of your routine, you can easily schedule a meeting with your health team. You can go through your care plan to see the tasks that you can do, things that you packed with your health team to improve your quality of life.
That's quite interesting. One P that you said, it's about prevention. So I'm very much interested to know how Ana Health works with the prevention, disease prevention area. Like, for example, if I would like, hire the services of Ana Health. So how can Ana Health help me to prevent any, future diseases?
First thing that I would like to say is prevention, if personalized, is much more powerful. So first thing that we want to understand when in touch with you is, what is health to you? How is your daily basis life? And through these conversations, when we meet each other better, we can collect all this data and in a lot of data points. And with this information, we can work with preventive actions in your care plan that will be fit with your context.
So we developed a technology here at ANA that we call OmniCare platform. We understand that the prevention and the healthcare happens in the daily routine, in the first mile. So OmniCare allows that the health team to be as close as possible to the person. We don't use the word patient here. We use associate. We don't use the word doctors. We don't have doctors. We have Olívio, Luis, Hugo. We have names, persons. We try to make the relationship as smooth, horizontal as possible. So closing our associates access the health teams with WhatsApp, phone calls, the means that they are already used to. And on our side, we have the OmniCare platform that concentrates all of these interactions and allows the health team to answer, to start a phone call, to send a message. And at the same time, we show the health team lots of information that can help the professionals to attend the associate. This information can range from health information as allergies, the last health issues, drugs in use and things like that, to really personal information as your dog's name, your grandma's name. So the next appointment, the professional can ask you about how is your dog and your soccer team, and bring conversations that create this bond. So the easy access to the health team and its presence in the people's daily lives, that is the first mile, allows that the data collected to deliver this personalized healthcare at scale. And the OmniCare offers another tools and other features that helps the health team to communicate with the person. So during video appointment, for example, we can make a face analysis and face recognition and start a sentiment analysis to understand if you are confused with the information that the doctor said to you. So we bring these technological features to focus on the human-to-human relationship.
That's very interesting, the use of technology for bringing the good to the humankind. Olívio, how do you see your shift? I mean, you just told us that you are a medical doctor, you are a surgeon, cardiologist, right?
Yeah.
And then now, working in this area with people like Vinicius and Victor, who are working with the product development, data, technology, artificial intelligence. How do you see what is the future of health?
Great. First of all, my job is to create the right team and then to create the environment in which that team can do their best. Everything are going to change in healthcare. I'm sure about that. And you have to think how the systems or the health system around the world are dealing with it. When you look at rich countries, you can feel that they have a lot of problems about deal with healthcare. And why is trying to solve this problem? Took the technology from the last mile. It means that I usually work with robots and video assisted surgery, using technology at the last mile, performing heart surgery or minimal invasive heart surgeries. It's amazing. It's technology at the last mile. When we start to understand that we could and we have to use the technology at the base of the pyramid, is in our mind the best way to touch people and to personalize the assistance. Then I think it's our journey.
I would like to listen from you three, Olívio, Victor, and Vinicius. What you learned from your failures, and what is that one thing that don't allow you to quit?
I can start. Today, during the morning, I talk with Vinicius, and we are talking about box. And, Muhammad Ali said one time for other boxers that he would go to win that fight. And then they asked him, why you are so sure that you are going to win? And then Muhammad said that I feel the taste of the bottom, and I don't want to stay there again. It's why I will win this fight. I can understand about myself that the system is completely failure. It's completely broke. They failed the system. People failed the health system. And I spent 20 years of my life there working the failure system. Then I know the taste of the bottom. It's why I want to go further and better. Make sense?
Great. Yeah, that's great. Victor?
To me, the purpose that we have, the feedback that we receive through our members, people that are using ANA, and mainly the support that we have in the team from each other. Just the believing that we are doing the right with the right people and doing the right to other people too.
That's great. Doing right with the right people, recovering fast, going ahead. Always keep, this in mind. That's great. Vinicius?
Well, I make Olívio's words my own, because what keep me from quitting is that the problem is not solved yet. So we can't quit. The system is still broken. The system is still mistreating the people. One story that is very remarkable for me is that when I had cancer when I was a teenager and was passing through the chemo sessions, we had a group of friends of 10 10 teenagers that attended to the sessions. And I had 6 sessions. At each time I went back to the hospital, one of these friends wasn't there anymore. It was very painful for me to see that. I know that there is no direct relation between the two events, but when I see a problem and I see people suffering from health, and I remember how it's painful and how it hurts, I cannot stop until it is solved.
This is quite interesting. I mean, this perseverance and persistence that is in your life actually is based on your own personal experience. And I can completely understand how closely it would have hit, your personal self and your family. And this brings me to the next question. What is the impact that you see of Ana health on the lives of the people around you now or in the coming few years? Or what is impact for you, impact of Ana health?
What people are returning to us during these months, saying that it's amazing to stay with unhealthy, the life is better. Now I have people that care about my health, things like that. It's like a gas for our engineer, when we start to see that the lives people is become better, it's amazing.
I can say that when you are feeling sick, Ana gives you 24/7 access to care. And when you are back on your feet, we give you the tools and the advice to stay healthy. So this is what we are providing to people and being very close to people during this journey. When we build when we build our own future, our own health system, the way we believe that it should be.
Okay, so my question to you is that the business model of Ana Health to me is very interesting because you guys are making money out of disease prevention. This is very much interesting for me. Why it is important to have more healthy societies?
For us, it's very important to have people happy by using Ana, kind of satisfied with the service and all the help that we provide to them. We have just one plan, very simple way to explain, with a monthly subscription that doesn't matter if people use more or less. What matters to us is that people stay healthy, and when they are sick, we will do our best to them to be healthier again, and even use this event to engage people in a healthier habits. So our business model works with healthy people, and we have a bunch of people that want to be healthy. If players that work with disease and make profit from disease, they will need hospitals. They will not be able to solve the problems with the right incentives, and they will stay in a failed system. So we kind of use the right incentives to make people healthy and have and be part in a huge market with a lot of potential.
Following Vitor, I think the Ana Health is a company that, of course, we wanna to make money. We think that this rude boat of money could be used to make people healthy. Disease is limited, and health is unlimited. The market of health is much bigger than the market of disease. This is the point that we think about business.
That's really great. Thank you very much. One last message that you would like to give to listeners or entrepreneurs. So please go ahead.
As I told, if you are involved with health tech, there is a great opportunity to make the world better. Let's go together to change the system, to break the system.
Thank you very much, Olívio, Victor, and Vinicius. I will be sharing your social media links and also the website of Ana Health on our social media platform. Thank you very much for joining us. It was a pleasure having you all.
Thank you, Almas.
Thank you very much.
Thank you.
For more information, access anahealth.app. Click here at the subscription button and click the like button to receive the latest news about Ana Health.
That's great. So, dear audience, I hope that you have liked today's episode. With this is your host, Dr. Almas, signing out till next episode. Take care and don't forget to subscribe our YouTube channel of Traces&Dreams.